Hi, my name is Olga. I'm going to be performing the tracheostomy care procedure here. I will start off by knocking, entering, and closing the door behind me to avoid any HIPAA violations. I will make sure that I will use the 2 patient identifications to make sure that it's the correct patient. I will introduce myself. Hi, my name is Olga. I'm going to be your nurse today. Can you please verify your name and date of birth? Okay, perfect. Well, today I'm gonna help you with your tracheostomy care. Is that okay? Okay, awesome. So next I will go ahead and take out my supplies here, and I'm gonna take out my gloves, put my clean gloves to the side. And I'm gonna take out my sterile dressing here. Just touching 1-inch border, sterile dressing field. Next, I will go ahead and dump my supplies on the sterile dressing, sterile field. Put this aside, and I will go ahead and fill these with the saline, the normal saline, the 1:1 peroxide. And I will go ahead and put on my clean gloves. I will hand hygiene, and then I will put my clean gloves. So hand hygiene, put on my clean gloves, and then we're going to take off this inner cannula. We're going to soak this in the solution. And then we're going to change the dressing. We're going to take off the dressing here. We're going to discard that with our gloves. We're going to take off our gloves. We will hand hygiene, and we will put on our sterile gloves on. Put this over. Only touching the 1-inch border over here. Turn it around. Touching the 1-inch border. I'm going to take the gloves here. Non-dominant hand. Gloves are on. I'm gonna get this out of my way. Not touching it. Okay, and then next I'm just gonna organize my things, all my supplies here. And I'm going to soak this in the saline, my swabs. Making sure that I have everything here. Next, I'm gonna clean, I'm gonna use a brush, and I'm going to clean the cannula. Inside, make sure that there's no secretion or anything like that. Discard the brush. I'm going to soak the inner cannula in the solution again, and I'm going to go ahead and lock this in place. Next, I'm going to go ahead and wash the inner the inner, outside, toss. And I want to make sure that it's I want to make sure that it's 5 to 10 centimeters above the stoma. Clean, discard, clean, discard, clean, clean, discard. Next, I want to go ahead and pat it dry. Then we're going to go ahead and change the padding on it. And we're going to take off this. Discard this, and we're gonna do one-to-one method. Placing this on. Making sure that it's straight so it doesn't irritate the patient's skin. And we also want to observe the stoma to make sure that there's no infection. And we're going to go ahead and make a knot here. Make a knot. And then we want to cut off like any excess tie over here. And then we're going to take another, we're going to do a pad knot here, and we're going to put it over. And if we do have tape, we don't want to place it over the patient's skin, just because we don't want to irritate that skin. I'm going to do the knot here. And then we're going to go ahead and make sure that the patient is at a comfortable position. We're going to lower the bed. We're going to make sure that the patient is comfortable, the cot light is available, and we're going to discard our gloves. We're going to discard everything. Discard our supplies, discard our gloves. Call light is available, patient is good, bed is lowered down. We're going to hand hygiene, and we're going to document our results. Thank you.